Your loved one is lying in the hospital bed before surgery and says, "They said they're going to put me to sleep, but I'm afraid I won't wake up." That fear is real. And if you have ever felt that way, you are not alone. But part of that fear comes from not knowing what anesthesia actually does. So, let's talk about it plainly. Many people think anesthesia means one thing: you go to sleep. But anesthesia is not regular sleep. It is not the same as taking a nap. And it is not just one injection that makes everything happen on its own. Anesthesia is a controlled medical process. It is planned, it is monitored, and it is adjusted throughout the operation. During surgery, the body can feel pain, pressure, stress, and stimulation. Anesthesia helps protect you from that experience. Depending on the operation, anesthesia may do several things. It can keep you from feeling pain. It can keep you from being aware of the surgery. It can help the body stay still or relaxed so the surgeon can operate safely. And, in some cases, it can place you in a deep sleep-like state until the operation is over. That is why anesthesia is more than sleep. It is pain control, it is awareness control, and it is body support. Not every operation needs the same kind of anesthesia. Sometimes, the doctors only need to numb one small area. An example of that is when someone has a small cut that needs stitches, they may numb just the skin around that cut. The person is awake, but that area should not feel pain. Sometimes, doctors need to numb a bigger part of the body. For example, the lower half of the body may be made numb for certain operations involving that part of the body, such as bone and joint procedures or a cesarean section. Sometimes, the patient does not need to be fully asleep, but they need medicine to help them relax, feel sleepy, or not remember much, such as for minor, interventional, or colonoscopy procedures. And sometimes, the operation needs the patient to be fully unaware and not moving. This is general anesthesia. That means medicines are used to put the patient into a deep sleep-like state, while the anesthesia team watches the body closely and supports their breathing, blood pressure, oxygen level, and comfort. These medicines change how your brain and body respond for a short time. You are not just resting. The goal is for you not to feel pain, not to be aware of the surgery, and not to remember it afterward. So when someone says, "I had anesthesia," the next question is, what kind? Because anesthesia is not one single thing. There are different levels and different types, depending on the patient and the operation. This is one of the most important things to understand. Anesthesia is not given at the beginning and then forgotten. During surgery, the anesthesia team is watching your body continuously. They are watching your oxygen level, your breathing, your heart rate, your blood pressure, your temperature, and how deeply you are under anesthesia. They are also adjusting medicines as needed. If your blood pressure changes, they respond. If your breathing needs support, they manage it. If your body needs more pain control, they adjust their medicines. Anesthesia is not just a medicine you are given. It is a whole process of care. Let's imagine a patient is going in for abdominal surgery. Before the operation, the patient meets the anesthesia team. They ask about medical problems, allergies, medications, previous anesthesia experiences, heart or lung disease, snoring, smoking, alcohol or substance use, and when the patient last ate or drank anything. That is not just paperwork. That information helps them plan how to safely take care of a patient. Then, the patient goes to the operating room. Monitors are placed. An IV is used. Medicines are given. And if general anesthesia is needed, The patient enters a deep sleep-like state. But while the patient is asleep, the team is not asleep. They are watching, they are adjusting, they are supporting the body while the surgeon does the operation. That is the part many patients never see. If you are having surgery, tell the anesthesia team the truth. Tell them about all the medications you are taking. Tell them if you take blood thinners. Tell them if you smoke cigarettes or vape. Tell them if you use alcohol, marijuana, cannabis products, opioids, cocaine, methamphetamines, or other substances that can affect your body or thinking. Tell them if you take herbal medicines, supplements, or vitamins, even if they were not prescribed. Some of these can interact with the medicines they use during surgery. Tell them if you snore loudly at night, use a breathing machine when you sleep, or have sleep apnea. Tell them if you have had problems with anesthesia before, especially with nausea and vomiting after anesthesia. There may be medicines they can give before, during, or after the procedure to help with that. Tell them if someone in your family had a serious problem with anesthesia. Tell them when you last ate or drank anything. If you accidentally eat or drink after the time you were told to stop, tell the anesthesia team. Don't hide it. They need to know because food or liquid in the stomach can become dangerous during anesthesia. This is not about judgment. It is about safety. The more accurate the information you give, the better the team can plan to take care of you safely. Before surgery, you can ask the anesthesia team what they are planning and what to expect. For example, what type of anesthesia will I receive? Will I be completely asleep or just lightly sedated? Will I need a breathing tube? What are the main risks for me, specifically? Is there anything in my medical history that makes anesthesia more risky? What is done to reduce the chances of me waking up during surgery? What should I expect when I wake up? How will my pain be treated when I wake up? These are not rude questions. They are important questions. They help you understand what is being planned for your body. Now let's talk about the fear many people have. What if I don't wake up? That fear deserves respect, but it also deserves clarity. Most people do wake up from anesthesia. That is the expected outcome. But anesthesia, like surgery itself, is not risk-free. Risk depends on the patient, the operation, the urgency, and the medical problems they already have. A healthy patient having a planned, minor procedure is not the same as a critically ill patient needing emergency surgery. Those are very different situations. So, when people hear that someone did not wake up, it is important to ask more questions before assuming anesthesia was the whole reason. Was the person very sick before surgery? Was it an emergency situation? Was there severe infection, bleeding, trauma, heart disease, lung disease, or another major medical problem? Did something happen during the surgery itself? Sometimes, anesthesia gets blamed for an outcome that may have been caused by the illness, the surgery, the emergency, or the patient's condition before the operation. That does not mean anesthesia has no risks. It does. But the story is often more complicated than they gave anesthesia and the person did not wake up. A few other fears are also very common. Some patients worry about breathing during surgery. Depending on the surgery and the type of anesthesia, you may breathe on your own, you may breathe with some support, or a machine may help move air in and out of your lungs while you are under general anesthesia. Some patients worry about waking up in severe pain. The goal is not usually to promise zero pain. The goal is to plan for pain control, explain what is realistic, and treat pain safely as you wake up and recover. And some patients worry that they may wake up during the surgery or remember what happened. That fear is understandable, especially when people have heard frightening stories. But the anesthesia team uses medicines to reduce pain, reduce awareness, and reduce the chance of remembering the surgery. Sometimes, people may remember things from the time they are waking up. That is, when the effects of the anesthesia they have received begins to wear off, either because the procedure is over or the patient has been given medicines to reverse the anesthetic at the end of the procedure. That can feel confusing, but it is not the same as being awake during the operation. If this has happened to you before, or if you are worried about it, tell the anesthesia team before surgery. Anesthesia is one of the reasons modern surgery is possible. It allows operations to happen without the patient feeling the pain of the procedure. It allows the body to be supported while surgery is being done. And it allows the surgical team to do what needs to be done safely. So, yes, it is okay to have questions, and it is okay to feel nervous, but fear becomes heavier when nobody explains what is happening. Anesthesia is not just sleep. It is not just knocking someone out. It is a controlled medical process that changes what your body feels, what your brain is aware of, and how your body is supported during surgery. It is planned care. It is monitored care. It is part of the safety system around surgery. You deserve to ask what kind of anesthesia is being planned for you, and you deserve to understand what is being done to your body. This is Med Affairs with Dr. Osa. If this helped you, leave your questions below and share it with someone who may need it. Tell me, what medical topic do you want explained next? Until next time.